welcome everybody.
Avi.
Waiting for few more participants. We are completely ready to start the event, but just waiting for few more participants to join in. Please bear with us. Okay, good evening everyone. We welcome you on behalf of Giants Group of Island City. First of all, I'd like to wish everybody on behalf of the Giants family a very happy yoga day. And on the health week, we are organizing a few sessions on yoga. We have with us Nargis Jasdanwala, who is a yoga instructor from the past 9 years, and she's going to help us with some guidelines on yoga. And today is a very important thing that we lack. We don't actually pay attention in our daily routine life. The breathing that we do, inhale and exhale, what we don't. So she will be giving us good tips and how it is going to help us and our body to relax, our mind to relax. Over to you, Nargis. We can start the session now.
Hello everyone and namaste. This is Nargis and today we're going to learn some breathing techniques. All right. So I expect everyone to have the guidelines that was given, the requirements on the group. So keeping a book and a pen close to you and some hard pillows, not really soft, nearby, so that can help during the session and you don't have to rush in. Also, I expect in case if you're sitting under the fan or close to the window, just help yourself with less of wind and stuff, so you can easily hear me and gathered and collect you all into the session. So let's begin. They're very simple. In case if you have trouble doing those basic stretches, avoid doing them. There are basic, these are the few basic instructions that I would like to give. Somebody who's been through a surgery very recently, try and avoid, be comfortable, do only as much as you can manage. Somebody with real blood pressure issues, on the higher side, in the past few weeks, avoid doing some breathing techniques. I will say as and when the pranayams come across. Also, somebody who's been into some injury, sort of some fracture, a heart patient, and a pregnant lady. All of these people, and somebody who's got asthma and a lot of restlessness right now. Try and gather knowledge from today's session rather than being part of it and being part of every pranayams. Am I audible? Yeah. So I'm going to speak as and when, give instructions, limitations, note them down on the piece of paper so you all will know and you all can practice it later on also. So we begin. First, we start with eye exercises. Look at any point in front of you, a small dot, not a larger object, just a small dot, and stare at it for the next 10 seconds. It will be a small dot. Fix your gaze on the small dot. There shouldn't be much features involved in the dot. Bring your focus there. Once you focus your gaze on the small dot, slowly and steadily take your eye upwards to the ceiling and then down to the floor. Up to the ceiling, down to the floor. Up to the ceiling, down to the floor. Up to the ceiling, down to the floor. And then to your right and to your left. To your right and to your left. Right, left. Now we're going to make a cross with our eyes. So look on the right side top, right top, and bring it to the left bottom. Right top, left bottom. Right top, left bottom. Right top, left bottom. Right top, left bottom. The other side, left top, right bottom. Left top, right bottom. Left top, right bottom. Let's repeat it. Up to the ceiling, down to the floor, to your right and to your left, right top, left bottom, left top, right bottom. Now we roll our eyes up, right, down, left, up, right, down, left. In circular motions 3 times. Do it as per your comfort. Do not rush it. In case if you're feeling dizzy, you can go slow. So therein, follow my instructions. Up, right, down, left. Up, right, down, left. Up, right, down, left. We do it the other side. Up, left, down, right. Up, left, down, right. In a rhythmic form. Up, left, down, right. 2 more rounds. Up, left, right. Up, left, down, right. Up, left, down, right. Now, squeeze your eyes. Squeeze your eyes. Squeeze your eyes. Open, squeeze, open, squeeze, open, squeeze, open. Relax yourself completely. Bring your hands in the front. Take a fist of it and make circular movements. Circular movements and the other way around. Stretch your hands, your palms, pull it backwards, rotate it downwards, pull down, up, down, and then bring it to the front and pull it backwards. Similarly with the other hand, pull it up, down, front and down. Once more, up, down, relax. Shrugging your shoulder 3 times, 2, 3, 4, 5. And to the front, 1, 2, 3, 4, 5. We'll do some clapping. 1, 2, 3, 4, 5. Backwards. 1, 2, 3, 4, 5. Up. 1, 2, 3, 4, 5. Downwards. 1, 2, 3, 4, 5. Take your hands behind and pull into your elbows and bring your hand down such that your fingers are touching somewhere between your shoulder blades. And if you can take it below, better. Pull in and the other side. Pull in. One more time. To your right, downwards, and then to your left. And pull downwards. Relax yourself completely. Take your hands to the forefront. Stretch. Look towards your right. You're pulling your hands to the left. Lock it at your elbows. Lock your right hand with your left hand at the elbow. Look towards your right. Release. And the other side. Repeat the same. Locking our left elbow with our right hand and looking to your left side. And relax. Now we are going to interlock our hands behind, holding our left wrist with our right palm. And stretching yourself down. When I say stretching yourself down, you're not going to slump. Instead, you're going to stretch yourself right from your tailbone. Now, where is the tailbone located? It is the start of your butt cut. Your butt cut, just where your butt starts. Try to imagine that you're pulling yourself right from that place. I'm going to just show you sideways. So here am I sitting. Right from this posture, I'm going to hold in there. I'm going to pull myself downwards as much as I can and go down. Allow your head to fall asleep. And allow your elbows and your hands to rest on your thighs. Stay there. Just in case if you're not bend too much because of your stomach or anything, you can make a fist on fist and place your head on top of it. But make sure that you're stretching right from your tailbone and not slumping around. Stay there. In case if you are still not able to reach the ground, even with your fist, use the pillow that I've asked for. Place the pillow on the floor. Place your fist on top of the pillow, one on the other, and then try to place your head on the fist and relax down there. Stay there. 1, 2, 3, 4, 5. Slowly and gently come up once again. Now we were holding our left wrist with the right hand. We're going to use the other hand. We're going to hold our right wrist with our left hand. The other way around, whichever one which you were using earlier, use the other one. And again, pull yourself downwards. Facing your forehead, hold the floor, close to it. Rest your elbows and your arms, hold your thighs and stay there. Use your fists in order to make a head breathe. Make sure that your head is rested at any cost. If not, a pillow and bend the fist. In case even if that is not feasible, then just make sure you're somewhere in the half and placing your head on the fist. All I want you to do is stretch from your bottom. I want your lower back to be stretched completely. And stay there for a while. Relax there. Slowly and gently, without any jerky movements, come up. Holding your wrist again, go and touch your chin. your shoulders to drop, be in the rested posture. Make sure that you close your eyes. So, gently bring yourself up and then go to your left. Touch your chin to your knees. Stay there. Make sure that you close your eyes. Slowly and gently bring yourself up and stay. Stretch your legs ahead. Place your palms on your thighs. Make sure that you're sitting in an L, a completely spurring. The next that we do is, in case if you're heavier on your lower side, try to pull in your butt off the floor such that your panty lines are nicely placed on the floor. Your panty lines should be nicely placed on the floor. Remove the extra flesh right from your butt, from your thighs sideways, and from your calves also sideways. Make sure that your toes are pointing towards you. Sit in an L position and stay there. Fix your gaze at the spot in front of you and sit here for 5 to 10 seconds. Make sure that your toes are pointing towards you. And your back is erect. Your shoulders not squeezed in. Relax your shoulders, relax your neck. Your chin parallel to the ground, your eyes fixed at the gaze. And your head parallel to the ceiling. Stay there. It's difficult to keep your back straight and sit without the support. Try this at your home around 2-3 times throughout the day. It will just help you correct your posture. Stay there. So bend your knees one at a time and hug your knees, making sure that your back is yet straight. Hug your knees as tight as possible. Slowly and gently release one at a time. And again, toes pointing towards you. And release the posture. We're going to start with some breathing techniques. Since you are well stretched and into the session, the reason for these basic stretches was so that the lethargicness just before starting the session, since it's an evening time, normally sleeping hours or chai pani time, so just brought some warm-up thing for you all. Now, what you can do, you have 4 positions to sit in during the breathing technique. I will show you all. One is when you place your leg, the right one like this, the left on top of it, such that a triangle is formed inside. This is a very comfortable posture and will help you keep your back straight. If not this, your basic Sukhasana. In this, you will nicely fold your legs and sit, but make sure that your feet is nicely touching the floor and it's not hanging somewhere. The third will be a Padmasana. The earlier one was Sukhasana, now this is Padmasana. Bearing. One of your knees will be higher from the floor and the other one will be touching. So try and sit like this, but in this position, whenever some hand movements are there, you're going to keep your right palm above the left palm and you're going to sit in this position, rear your navel. And the fourth and the little more difficult position is Vajrasana. Bearing. You form a cup with your feet and you place your butt in the cup. And you sit straight. Basically, your toes are together, your heel apart, and your butt resting on the feet. This position is difficult for sitting a long time, especially when you have a knee issue. So the earlier positions could be tried interchangeably, even with the left and right accordingly. Make yourself feel comfortable, but make sure that you are not getting tired while doing the pranayama. Okay, I will choose one of my favorites. The first one. This lets me even flex my thighs, calves, and my butt, which is a very good posture. Again, remove the flesh off your butt backwards and from your thighs sideways so that you are nicely seated on your sitting bones and not on the flesh, because that will again make you feel tired and you will kind of slouch like this. So instead, make sure that you're sitting nicely on your sitting bone. Now we begin. So first, place your palms on your feet, on your thighs, or else you can place your right palm around the left palm near your navel, whatever is comfortable. Make sure that your shoulders are not stressed. They're nicely relaxed. Your elbows close to your body in this posture or in this posture. Your neck is at ease. Your focus fixed. Chin parallel to the ground. So I'm not bringing my chin close to the chest, nor am I keeping it up high like that. Relax such that my forehead is parallel to the ceiling above. All right? There, I place my palms on my thigh like this. Close my elbows and slowly focus on a particular point in front of you. Go to the dot which I had asked you on earlier. Focus on a point in front of you. Focusing. Be very sure. Why in the next 45 minutes, then the breathing techniques that I teach, make sure you don't open your eyes unless asked. You don't make any unnecessary movements. Keep a book and pen ready. So whenever I ask you all to take it down, I will give you all that few seconds to write down the limitations and the when and when, how many times it could be done. All those instructions will be given. The question and answer session will happen in the end, so you can write your questions down as well. But I'm going to give you the time after every breathing technique. So do not interrupt, do not be restless, and kind of involve your mind in writing down so that you don't miss out anything. The time will be given. All right. So keep focusing on the point in front of you. Slowly and gently. Fixing your gaze on that point, on that smallest object which you set your eyes on. Slowly and gently close your eyes. Slowly and gently close your eyes. Imagine the object, the dot that you have just seen before closing your eyes for the next 10 to 15 seconds. How well you can imagine the object that you just saw before shutting your eyes. Recreate the picture in your mind. Your eyes are closed. Do not squeeze it. Let it be light on your pupils. Beginning. We will focus now on the sound around us. This is the most beginner's technique of bringing your attention, your focus into meditation. This whole session is going to be about breathing techniques and meditation. So we are now going to focus our mind on a sound around us. Now, what kind of a sound are we going to focus on? We are not going to focus on any man-made sound. Rather, we're going to focus on a natural sound. It could be the chirping of the birds, the wind making noise, the window curtains. Now, when I say natural, human beings are not included. So do not focus on that noise. If somebody is talking in the next room around you, figure out something around that is natural. And if there is no noise around you, then you can probably focus on your breathing abilities. Just the way you're taking your breath in and out. So I'm giving you two choices, either a natural sound, not a man-made sound, or your own breath. Focus in for the next 15 to 20 seconds. There will be moments where you will feel irritated being in the posture. Focusing on the breath. Your mind will again and again divert. The only solution to this is bringing yourself back to the breathing, back to the sound. If the natural sound has just faded, focus on any other sound around you. In the next 1 minute, simply focus on the sound around you or your breathing. We begin. Stay focused. Bring your attention back to your breathing. Come back to your sound. If you are focused, don't bring those thoughts of what you're going to do next after the session, or some issue in the morning, or some humor that you've gone through, or any thoughts whatsoever, just on your breath. In case if you're not focusing, I would clearly say this would be a waste of time. So make sure you're utilizing every bit of the time that you're getting right now. Focus on the sound or your breathing or your breath. Slowly and gently, place your palm. Do not open your eyes until I ask you. Place your palm, your right palm on your abdomen. Your left palm will be resting on your left thigh. Bring your focus on your inhalation and exhalation. This on your abdomen. Just check the way you're breathing. Now, first of all, we need to learn the correct way of breathing. Usually, how we go about this. When you place your right hand on your abdomen and you inhale, you will inflate your abdomen like a balloon, as if air is gushing in, so your stomach is blowing out. And when you are exhaling, you will flatten your stomach and take your tummy to your spine. I repeat, when you're breathing in, that is inhalation, you're going to blow your stomach like a balloon. And when you're deflating, that is breathing out, exhaling, you're going to flatten your stomach and take it to your spine. We do it the other way around. We usually don't play focus on the breath. So this is the correct way of breathing. This is how a normal child, a just born baby, will breathe like. And human, while sleeping, we tend to breathe the correct way. It's only when we are in an activity we tend to breathe wrong. Most of us, some may be breathing correctly, but right now let's just focus on breathing correctly. So placing your hand on your abdomen, you will observe your breath work. That is by inhaling, you blow your stomach out, and while exhaling, you will deflate your stomach and take it back to your spine. I will give you all instructions. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So this is the first pranayama, which is called as equalization of breath. Just understand, I will give you all time to note down. This is known as equalization of breath, wherein you're correctly breathing in and out. Now we will time this. So we'll inhale for 3 counts and we'll exhale for 3 counts. Keep your eyes closed, your back straight, your shoulders, take it up and then pull it back, throwing your chest out. Make sure that you've not curved your back behind. Your butt is risen. You are nicely placing your sitting bone on the floor. You've not slouched. Your elbows are close to your body. Your palms are nicely placed on your thighs. This is just a auto correction of your body posture. Make sure your chin is parallel to the ground. Your forehead is parallel to the wall in front of you. And your eyes nicely shut. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay. Inhale, 1, 2, 3. Exhale, 1, 2, 3. While you are inhaling and you are exhaling, make sure you're not giving any jerky movements. Your breath should be very rhythmic and it should go in one flow. Jerk like this. You should nicely take a rhythmic breath in single flow easily. If you cannot take it in 3 counts, take it as much as you can. Exhale as much as you can. But make sure it is equal. If not 3, make it 1:1. If not, or else 2:2. We start once again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. That's now we move on to the second breathing technique. This is called as intercostal breathing. In this, we're going to place our hand on our waist, feeling our ribs, just the ending of our ribs, wherein just a stomach will start. We're going to place our hands there, as if you're trying to shout at someone and you're holding at your waist. In case if you all cannot understand my instructions, you can open your eyes and just observe me. Now while inhaling, we again inflate our stomach, feeling the ribs, and while deflating, we feel our ribs again. This is all about feeling the ribs, the expansion of our chest, and the closure of our chest. Okay, once you have understood the instructions, gently close your eyes once again, placing your hands at your ribs, just the ending part before the stomach begins. Place it nice there. Do not tighten it. Loosely hold it there. Inhale. 1, 2, 3. In case if the 3 counts are difficult, I'm going to come down to 2 counts. For beginners, it is ideally advisable that you stick to 1 or 2 counts. Slowly and gradually, you can progress to 3, 4, and 5. Maximum is 5. And for somebody who has done pranayams for more than 6 to 8 months, you can extend it to 6, 7, 8 accordingly. You will have to practice it under a teacher's guidance initially, and then you can carry it by yourself. We begin. Inhale, 1, 2. Exhale, 1, 2. Feel the expansion and the contraction of your ribs. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Make sure you're following the instructions of inhalation, exhalation that I taught you while teaching equalization of breath. That is, while inhaling, you're going to inflate, you're going to blow your stomach like a balloon, and while exhaling, you're going to flatten your stomach. Then inhale, 1, 2. Exhale, 1, 2. 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 Stay there for some time. Be prime. Relax yourself. When I ask you to relax yourself, all you have to do is again go to the basics. That is just paying attention to your breathing. That is your inhalation and exhalation. Whenever there's a transition from one pranayama to other pranayama, the gap should be filled in by just pure plain inhalation and exhalation and focusing on it. Stay there, keep your eyes closed. Focus on your breathing. Again, try one more time. 3 rounds of inhalation and exhalation. Intercostal breathing. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Opposed. Now we slowly move our hands to our collarbones. We're going to place our palms on our collarbones and hold it like that. This pranayama will be known as clavicular breathing. While inhaling, so there's a tendency that we understand for basic people that when we breathe in, the breath goes from the nose right from our chest to our stomach and to our lungs. No, that's not the process. When you breathe in, it's your lungs that fill in first, and slowly and steadily your other body parts get the breath, the inhalation. So now when we're doing intercostal breathing, you have to focus, right? When you breathe in, you should focus that as if, imagine. I know it is very difficult to understand this all together. So imagine that the first your breath, the fresh air, has gone into your lungs and slowly towards your stomach, your chest, and your bones. You need to feel the freshness at your bones. This is for right now. It is going to be very technical for you all, and you all may fail to understand. But with time and with regular practice, you all will be able to observe this happening in your body. Right now, it's going to be just words and just basic instructions, which will not make sense to you all right now, but just follow it, learn it, understand it. You all can do your research later of what is more comfortable to you all and accordingly do it. So we're going to place our hands back on our collarbones. Okay, here are our collarbones, just where the collar is placed for a shirt. Breathe in. Again, we'll stick to our 2 counts. Inhale. 1, 2. Exhale. 1, 2. Inhale. 1, 2. Exhale. 1, 2. Inhale. 1, 2. Exhale. 1, 2. Slowly bring your hands down, relax it on your laps. Keep your eyes closed and yourself focused. Once again, placing your hands back on your collarbones. Inhale, 1, 2. Exhale, 1, 2. Make sure that your inhalation and your exhalation is rhythmic. You are not giving any jerky movements. You are not taking two different breaths when I ask you for 1, 2. It is systematically, rhythmically together. This is known as clavicular breathing. clavicular breathing, clavicular breathing. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2.
Ayo.
All right, calm yourself down. Place your hands back on your laps and relax yourself. Now we slowly move on to our fourth breathing technique that's called as diaphragm breathing. In diaphragm breathing, we have to lie down on our back. So just look at the way I lie down and you will follow gradually. So I'm not going to directly just go like that. So just add a way of sleeping. You're going to fold your legs, keep one on top of the other. Place your elbows down. Slowly go down and settle. Make sure that your knees are placed together and your toes, if you are not comfortable, you can separate it and stay there. Now place your palm, right palm on your navel. Your navel is your belly button and your left palm facing the ceiling on the floor. Your eyes closed. In case of this light which is falling on your face for some reason, then try to close your eyes and look towards the downside. That will give you darkness in the eyes and any light around will not bother. This is known as diaphragm breathing. I'm going to make your write down later in the next 15 minutes. So don't bother yourself. Just follow this exercise. We're going to stay this long now. Now, in this particular breathing technique, make sure that your back is nicely placed on the floor. So for that purpose, you need to take your knees as close to your chest as possible. In case if you have an issue due to your stomach, you cannot bring your knees close to your chest, or you can bring them up in the air like this, so that your back is nicely rested. Now very slowly and gradually, bring your foot on the floor, one after the other, so that you again don't bring the gap between the base and the floor. All right, and your back is nicely rested on the floor. Now place your right palm on your navel, that is on your belly button, and your left palm facing the ceiling. Close your eyes and just plainly observe the breathing. This is exactly what I spoke in the first pranayama that I taught, equalization of breath, wherein a small birth, a child which is just born, he will breathe correctly. A person lying down will breathe correctly. It's only when your body is active that you tend to breathe in a wrong fashion. So right now, you don't have to focus on anything. Just lie down, make sure that your focus is on your breath and not anywhere else. And your breath will automatically happen. That is while inhaling, your stomach will bloat, and exhaling, your stomach will flatten. When we close our eyes, make sure that your shoulders are nicely pressed on the floor along with your back. Keep a gap between your knees. In case it's not possible, you can keep your knees closer and your foot apart. Focus on your breathing. Relax yourself completely. Not in any thoughts. Mainly focus on your breath. In case if your mind wavers, bring it back to your breathing. Just focus on your hands and your abdomen. Wherein while breathing, your stomach grows, and while exhaling, your stomach flattens. So that is all that you have to focus on. It is not to focus on your breath, focus on your stomach. Do not go off to sleep, please. This posture is normally very relaxing and you can go to sleep. Being the sleep hours right now, for the 5, 6 hours, you need to make right now. Right after the kitchen, please. This is the lowest moment of the day. You can re-energize yourself. And then have chai, whatever. Relax yourself. If you have anxiety issues, if you have overthinking issues, if you have depressive thoughts, this posture is very comfortable for them. This posture. So gently lift the hand down, turn to one side of your body, make a pillow of your palm, of your hands, place your head on it, place your left hand on the mat or the floor, your knees topped on one another. Relax yourself completely, stay there. Slowly and gently apply pressure with the left hand on the palm, keep your eyes closed, open your eyes, come back. Posture. Whichever way you're sitting is okay. Do not correct yourself, just stay there. Slowly and gently bring your palms against each other and rub them, create good warmth and place it. Cup your eyes, place it on your eyes. Do not squeeze your eyes, do not flatten the palm on your eyes, rather keep it far. Enjoy the darkness. You will see a reddish bluish layer or color. Slowly widen the gaps of your fingers. Opening your eyes slightly, bring your hands down. Now, with a piece of paper and a pen next to you, I'm going to give you all some notes, like I promised. Just note down.
Nargis, fine. Okay, people, if you all have any kind of questions, please put it on the chat box. I think Nargis, is it okay? You can revert on that also, if any query.
Yes, first just take down the notes. So, you all can have whatever we did today, and then we can go back to the questions. I have done the basic 4 techniques of pranayams today. There are at least another 10 to 12 pranayams that can be practiced, but those are of higher level. The reason I didn't go much technical in today's session is because I wanted things to be a lot easy, accessible, and not difficult on the head. Because once the mind feels that a particular thing is difficult, we tend to kind of not do it. So I wanted things to go very basic, so people who do not have the habit of breathing correctly, the ones who do not meditate, can start with it, and slowly and steadily we can progress. So the first thing that we did was focusing on the sound. So the first pointer that you're going to write is sound. Before that, make sure that you all are doing some stretches so that you all can get ready for the breathing pranayams and the breathing techniques. because that is very helpful. You just get out of the bed and sit in the breathing. You'll feel lazy. You won't give your 100% to the pranayama. So do the stretches. Then the first is focus on sound. Below, underline it, write down, focus on natural sound, not man-made. Natural sound, not man-made. You can write natural sound and put a tick over it, write man-made and put a cross over it. Or else, your irregular breath, that is just the way you're breathing, without correcting it, just focus on that. In case if there is no sound around or no natural sound around. So write down, first is either natural sound, tick, man-made, cross, or the third pointer would be your irregular breath work. Then the second one we did is equalization of breath. Now, equalization of breath, you just don't have to write anything. You have to write inhale is to exhale, that's 2 dots in between, and write either 1:1, 2:2, or 3:3, slowly progressing to 5:5. This entire process of focusing on the sound, equalizing your breath, and then doing the following 3 other pranayams will take you at least 2 months to give it 5, 10, 15 minutes of the day. So first begin with half a minute, progress to 1 minute, then progress to 2, 3, 5, 10, 15. That is going to take a lot of time. It is not going to be that easy because your mind will keep wavering. So just start with as simple as 30 seconds, form a habit and slowly progress. So the second one that I said was equalization of breath. The third one is intercostal breathing. That is placing your right hand on your abdomen. So before that, now equalization of breath also has this one point where you are inhaling, you're going to inflate your stomach like a balloon. So right, inhale ki baaju mein balloon. So you will realize that you have to blow your stomach out. And exhalation ke time pe right, next to exhalation, right, flatten. So you will realize you have to suck your stomach in. All right. So this is supposed to be followed with your equalization of breath. That is your inhalation. This is the correct method of breathing. And along with it, you can do 1:1, 2:2, 3:2. Make sure that your exhalation is nice and smooth. So also write the pointer, no jerky movements. That is, you are not dividing 2 breaths between 1 and 2. You are taking 1, 2 together, 1, 2, 3 together. Okay. Then we come to third one is intercostal breathing. We place our hands at our abdomen. All right, and then we breathe accordingly. Fourth will be clavicular breathing. Intercostal is the rib one. Remember this. Placing your hands at your ribs. Also, it could be placing at your abdomen in case if it is difficult to hold in like this because of any injury or issue. The fourth one is clavicular, where you keep your hands at your collarbones. The technique is the same. The clavicular breathing has deep breathing. It follows right from your lung to your clavicular to your collarbone. And when you exhale, you will feel downwards. So always follow that. It is going to take a lot of time to understand this. I can completely understand. Only somebody who's practiced this for 6 or more months will even get the idea of what I'm talking right now. But also these are the basic pranayama techniques. So it's not something that I couldn't provide you on. But just right now understand that clavicular breathing goes downwards to upwards. It's not the normal human tendency of thinking कि सांस लिया तो नाक से नीचे तक जाएगा. No, it's your lungs that bloat in first and then following your clavicle. And the fourth is the diaphragm breathing, wherein we lie down and we place our hands on our abdomen. Make sure that your back is straight. So in the fourth, write down diaphragm breathing. Write down, place your hands on the abdomen, your right hand on the abdomen, that is near your belly button, and your left palm facing the ceiling on the ground. Your knees bent, your back nicely placed on the floor. Make sure that your shoulder blades are nicely pressed on the floor. Your body is completely rested before you start breathing. Okay, now I am going to give you all benefits and limitations of all these 4 pranayams. Before I start taking the questions, give me a second. Yeah. So the benefits of all of these is these are all basic pranayams. So the first and the foremost benefit would be good for concentration, improving your breath work. These are all basic. So you can write concentration. That's the first word. Improve breath work. Your breath awareness. It creates awareness of how you're breathing. It is very important. It helps to calm down the mind, calm down the anxiety just before an event. You can do any of these 4 pranayams. It will help you relax before doing anything important where you feel a little agitated, irritated, if you're angry, if you're upset. You can do any of these 4 breath works that will calm down you a bit. You'll need a lot of practice before it starts actually working for you all. All right. Then the pranayam that we did while sleeping, that the diaphragm breathing also helps in digestion. So yes, you have to sleep on the left side of your body. That will aid your digestion. Also, the sitting posture that I taught you, Vajrasana, this is the best posture to sit in while you're eating food. The tendency is that you will eat less. Also, after eating, you can simply do some breath work by sitting like this. It will aid digestion. This is an excellent posture for digestion and for eating less. So keep this in mind. Now the limitations are very limited. They are either fractured ribs for your intercostal breathing, if you have any internal injury or a surgery done. If you're a heart patient and if you have a lot of difficulty in breathing, then stick to this equalization of breath, that is inhalation and exhalation 1:1. That is it that you have to do at the beginning. Accordingly, when you improve on your health, you can slowly progress to the next 3. Somebody who's got asthma, who's got this tendency of these bouts happening again and again, you all can stick to the first breathing, that is again equalization of breath. Somebody, you shouldn't have a broken collarbone or a neck injury, or you could say an arm injury to support your back should be, if you have back pain or something, rest yourself on the wall or a hard pillow. Or else, there's this particular seat that you get in the market. It aids, it is like for a back posture correction along with your sitting correction. So you can buy that and sit on that. It will automatically help you. So yeah, and also if you have inflammation, something like ulcers in your stomach, or probably piles or something, which releases blood through any sources, then avoid deep breathing a lot, because the tendency is that the inflammation might just get increased in case if you don't do the correct network. So be in control of that, and otherwise you can follow all of this. Now we can take questions. So can we just start with the questions quickly, please?
All the participants, if you have any questions, please put it in the chat box and we'll put it up to Nargis and see what answers she has for us.
Also, just before I take in the questions, I forgot one point. People suffering with high blood pressure, make sure you do things only when you're in best of health and not when your pressure is on the higher level. You can just calm down and focus on the sound or basic breathing. Do not opt for intercostal, clavicular, and diaphragm can be done by anyone and everyone, except if you have a surgery and you're not allowed to sleep flat on back, then otherwise. Yeah, please give them the questions.
Any of the members, any of the participants have any questions for Nargis with regards to breathing and the session that she's just taking today? I think it was a very well taken session. That's why we don't have any questions in our case. So if you
I think it was a very well made session and a very well instructed session. So I think there are no questions.
Okay, we have a question. Mr. Murtaza asked, any exercises especially for weight loss, Nargis?
Yes, you can do Surya Namaskar. You can start with 10 rounds of it, both right and left, and slowly increase up to 54 and 100. It's the best form of exercise, and you won't need gym for that. You won't need gym after that. So yeah, Surya Namaskars will work best for weight loss.
Thank you.
All right. We have
Thank you, everyone. It was a wonderful session, Nargis. Thank you very much. I'm sure it's going to benefit everybody from this, and we look forward to the other 2 sessions also coming up. Thank you, participants, and we'll end over here now. Thank you once again, and wishing you all a very happy International Yoga Day.
Thank you, everyone. Bye.
Bye.
Thank you, Nargis. Thank you. Bye.
Bye. Thank you.
Bye.